Diabetes is a serious chronic health threat.
Diabetes.
Type 2 diabetes.
With diabetes.
Type 1
Diabetes.
diabetes.
About diabetes.
Diabetes.
Anything can go wrong.
Pre-diabetes.
Diabetes.
It's amazing how much everything affects your blood sugar.
I woke up at about 6 in the morning and I phoned 811. And the doctor came in and I said, "Oh, cool. Can I go home now? I feel better." And he looked at me and he said, "You just had a heart attack." I was young. I was 35 years old. Like, who has a heart attack when they're 35? And then I decided it was time to change my life if I wanted to live. So I started going to the pool and swimming. And then one day I kept seeing everybody up in the gym and I thought, oh, I want to try that. So I started doing the gym and here we are 4 years later, 100 pounds less, 200 pounds less insulin. Doing a lot better, yeah. Like I said, before I had diabetes, I knew nothing about diabetes. Until I got it, I educated myself because it was now part of my life. It was in my world and I have to know about it. So I did, and I do. For me, it was because I had overheard two people having a conversation over food saying, "Don't eat that, you don't want to look like Monia." And I thought, oh my God, I'm now a reference. And from there on, I didn't want to be that anymore. And that's how I did it. But I think everybody's individual and until they're ready to change. But they have to want to change. They have to want to quit. They have to want to get healthy. You can't tell somebody they have to, because that rarely works. Education is number one. Soon as you find out you have diabetes, you need to be educated on it. Just like if you had a heart attack, you want to be educated on it. You have a baby, you want to educate on how to raise a baby. It's the same thing. You find out you have a disease, you educate yourself and know how to control that disease. I talked to my pharmacist, I talked to my doctor. Actually, when I got it, our specialist, she was amazing. She would email me my numbers, tell me how much insulin to inject. She was phenomenal. She taught me a lot about my diabetes. And then the rest I Googled, looked it up on the internet, knew how to check my numbers, knew what my number range should be and knew either eat less, eat a little bit more, whatever. I just did it on my own. Yeah, and we have technology. Everything is right there now. And I've been seeing a specialist for other issues, and she's been ordering other blood work. So we're finding out more things now about me.
So as we move forward to looking at the complications associated with diabetes, we have a little bit of an acronym that we like to follow, and that's the ABCDEs of diabetes. So A stands for A1C, essentially our blood sugar control.
B is for blood pressure, C is for cholesterol, D is for drugs, E is for eating and exercise, and S is for self-management, screening, and stopping smoking.
When we put that in a nice little package and are able to follow these rules, we're able to drastically reduce the incidence of some of these complications that are associated with diabetes and continue to live a long, healthy life, even if we're diagnosed with a condition.
I get my blood work done every 3 months for my A1C.
Yeah.
I also take telmisartan, which is a good heart and diabetes medication.
Exactly, yeah.
And I take bisoprolol for blood pressure, which I used to have really high blood pressure. Now it's spot on.
Nice.
I test that about once or twice a month.
Okay, yeah.
I have my own machine at home, so that's even easier to do. When you ask if people know their blood pressure, their cholesterol, like my doctor will do it once a year for my cholesterol. And mine is really right on target, which is awesome because when I had my heart attack, it was through the roof bad. And I like how it got that bad was, well, I guess I could see how I did, but now it's really good. It's on target.
In terms of like cardiovascular risks that are associated with diabetes, checking your blood pressure. So even if your blood pressure is normal, like a lot of pharmacies do, if you don't have a blood pressure cuff at home, you can go check your blood pressure. And the other thing is you don't have to do it every single day. Unless your doctor tells you that you need to do it every single day. But often enough, most of us know that every few days is more than sufficient, because if you're checking it every day, you're going to freak yourself out and then you're going to get fixated on the numbers. So every other day is like perfectly fine, or maybe even like once we get your blood pressure adequately controlled, like once a week, even like so. And that's why sometimes it's nice because people are like, oh, that means I have to go to the pharmacy like every few days or whatever. It's like, well, then ask your doc. Like we do, I believe, have some funding, or if we can prescribe blood pressure cuff machines to help offset some of that cost. And then you can just check your blood pressure at home.
An important part of diabetes self-management is checking your blood pressure often. You can either go into the pharmacy and check in their in-store kiosk, or you can buy a Hypertension Canada approved blood pressure machine and check it at home. To start, you want to sit quietly and relaxed for about 5 minutes. Keep your feet flat on the floor with your back well supported and bare arm at heart level to get the best readings. To fit the blood pressure cuff properly, we do what I like to call a 2-finger rule. Keep 2 fingers off the crease of the elbow. It's about 2 fingers looseness that you can fit 2 fingers into the cuff itself, and keep the cord right in line with the artery that it's listening for. The best time to test is after you go to the bathroom in the morning, but before you eat. And you want to take 3 readings. The first one we just throw out. We call that our practice run for the day. And you take an average of the second 2. That's the number that you want to write down and bring into your health providers for analysis and discussion. You want to make sure that you're not going to do anything that elicits an emotion. So you don't want to be talking or watching TV, anything like that. And it's important to use the same arm every time. That way you can keep consistency in your readings. Now let's move to the D of diabetes, which is drugs to help to reduce the risk of having complications due to diabetes. So here's a handy chart that I like to use, which was devised by the Canadian Diabetes Association. And if we start at the top, it asks, does the patient have cardiovascular disease? So essentially it's asking, has a heart attack or stroke occurred already? And if you have had a heart attack or stroke, or something else that would be considered cardiovascular disease, we follow that over to the side, and it shows that there should be a cholesterol pill, a blood pressure pill, and aspirin. If you take a look next to those words, there's little numbers, 1, 2, and 3. So we have to follow that to the bottom to see exactly what they mean. So essentially they're saying if your bad cholesterol is not less than 2, we need to add therapies to help to bring that number down, that we don't remain at an increased risk of having cardiovascular disease. There's only 3 blood pressure pills that have evidence in diabetes populations to actually reduce the risk of heart attack and stroke. Other ones may have benefit, but we just don't have any evidence to support that. But it's helpful to know that if you're on a blood pressure pill and you have diabetes, you might want to see if it's one of these 3 options here: perindopril 8 milligrams, ramipril 10 milligrams, or telmisartan 80 milligrams. Because if you're not, it might be worth a discussion with your healthcare providers just to see if you might benefit from one of these options instead. The 3 next to ASA basically says if you've had a heart attack or stroke in the past, you might benefit from ASA therapy or aspirin therapy. However, if you've never had a heart attack or stroke in the past, ASA therapy may not be that beneficial for you and actually increase the risk of harm versus the benefit that you would get from it. So it would be worthwhile to talk to your healthcare provider to ensure that if you are on aspirin, it's right for you to continue. This actually kind of goes from an old guideline to say that everybody with diabetes should be on aspirin. However, as future studies came out, it shows that there's really not much evidence for aspirin if you've never had a heart attack or stroke in the past. So as you move down the list, you can see why it's not included. And I think that's kind of where we're going to stop for today, because we'll be talking more in detail about microvascular disease in the next episode as we move forward.
it was just time to not be that anymore. I needed to be healthy. Yeah, I have a young son, and I had to be here, right? I got on that treadmill and I could walk on it for 6 minutes. That was it. 6 minutes, and I was exhausted. And it's, to people who are used to it, that's a joke. To me, that's a joke now. But it was 6 minutes, and I do that for a week. And then I went up to 8 minutes, and then I went up to 10 minutes. Now I can go on there for 2 hours and it wouldn't even bother me. But yeah, in the very beginning, everything was brand new and it hurt. Like, it physically hurt to do it, or I couldn't breathe because my body wasn't used to any of the exercises I was doing. But now, like I said, I can ride a bike for an hour. It wouldn't bother me. I can do the treadmill. I can lift weights. Whereas, yeah, in the beginning it was hard. And you want to quit because it's too hard. But you just have to push yourself and not quit. With the diet and exercise, it made me drop over 120 units of insulin. Yeah. So that was a lot.
Patients come in to see me and they often ask me, like, where do I start? How do I begin this journey of getting my health back? And I refer them to the Diabetes Canada website and their guidelines being doing aerobic exercise 4 to 5 times a week, and that's 30-minute bouts, so a total of 150 minutes a week of aerobic exercise, and that's moderate to vigorous exercise. There's a lot of research around high-intensity interval training being really effective. So for those of us that aren't able to, do these long 30-minute bouts or more of exercise, you can do shorter bouts of vigorous intensity exercise. For instance, like, say, riding a bike for 30 seconds or a minute at a high level, taking a minute to 3 minutes break in between and doing a few repetitions of that is just as effective as, doing long-term exercise. So for those of us that are like me, where I want to get as much out of it as quickly as I can, that's a good option for us. And then with resistance exercise, we want to be doing that 2 to 3 times a week, just helping to build some strong, lean muscle. When you start exercising, it can be daunting. So just, you got to start easy. Just start low, go slow, build up gradually. So even starting with 5 to 10 minutes of activity is a good way to start. And it's really important as we get back into the setting smart goals. So, what am I doing this for? Who am I doing this for is really important to take into consideration. And it's really hard. It's a struggle for some of us to accomplish these things by ourselves. So reaching out to groups of people that are going through the same situation, finding that support, and they can help people with, the stress and mental anxiety and all this around these conditions. So having that support group only helps to build what you're able to do.
I do my workout upstairs in the gym for an hour and a half. That's where I work out hard.
Yeah.
And then I go down and I swim for an hour and a half. And that's more gabbing, social, just having fun.
But that's what it's all about.
That's right.
Yeah.
That's right. Because
It's
you have to
finding the
have
things,
that.
Yeah, exactly.
Yeah.
Find the things that you enjoy doing, because
right.
then it doesn't seem like so much work, right?
That's right. Like I said, it doesn't become, oh, I got to go to the gym again.
Yeah.
It's, oh, I got to go do what I got to do.
Oh, totally. Yeah. Yeah. And I mean, if you can kind of like combine that socialization that helps with the mental health aspect.
That's right.
As well as the exercise. So
That's right.
Yeah.
And then you can compare notes with other people, and you find out people in a similar situation. It's easier when you hear and you can relate.
yeah, absolutely.
Then you can help.
Yeah.
Or you can get information you didn't know about.
I would say sedentary lifestyle is kind of one of the biggest things that I see. Excess weight, sometimes even for adequate blood glucose control in people that have polycystic ovarian syndrome, losing 5 to 10 pounds is what helps them regulate their hormones, what helps regulate their periods again. So it's similar in diabetes as well. Keeping that excess weight off, staying active, like getting that plaque out of your arteries and not deposited there, I would say is kind of the big one.
The other one I treat fairly frequently is people who have suffered a stroke as a complication of being a diabetic. And there's multiple layers to having a stroke. For instance, one of my patients that I was treating had lost the ability to walk. And their goal was to be able to be independent and walk around and, make themselves breakfast or just even have a coffee. So helping them be able to learn to walk again and being able to get around independently is super important. And I think it's just empowering to that person to be able to see, what they can achieve after doing a bit of physio.
I know my numbers, and I know when I'm good and I know when I'm not. And I know a lot of people that have diabetes that don't know about their diabetes, about their numbers and what their A1C means and how to adjust their numbers. The more you know about something, the better you're going to be at it. Right? So you know your diabetes, you know your body, you know how it works, you know how it's going to react, then you know how to treat it. I was a smoker for many, many years. After my heart attack, doctor told me I had to quit smoking or it was going to kill me. I didn't quit. It took me a year after my heart attack to quit smoking. But everybody kept telling me to quit smoking, and that made me smoke more. So until somebody is ready and somebody wants to make the change, they can't. You can't make somebody do something they don't want to do.
Smoking, for a variety of reasons, is bad for your health. We know this. And particularly in respect to diabetes, it's that plaque formation that's happening in your arteries. So that plaque formation is happening because there's damage that's being done to your arteries. And it's a buildup of lipids, so fats, and smoking also damages your arteries. So that plaque's forming and narrowing your arteries. So not enough blood is able to pass through the arteries like there usually are. And we see with diabetics that are also smokers that they're more likely to get kidney problems and like the other kind of long-term sequelae of diabetes, because with diabetes, you already have that plaque formation, and then adding smoking to that mix too, you're just adding salt to the wound, for lack of a better description.
So after my workout, sometimes I end up with a sugar low, and I usually carry some fruit snacks. So when you have a sugar low, it's 15 grams of sugar. This is about 15 gram sugar packet, and I'll eat one of these. And hopefully I never have to, but if for some reason I'm having little heart problems, I've got my nitro. I always carry it with me in my gym bag, and my extra medications that I need. So I'm always prepared. Just never know what's gonna happen. I didn't know I was gonna have a heart attack when I had a heart attack. So I try to be prepared now for anything that comes. Diabetes is not a death wish. It's not a death sentence. You might die from complications due to other interactions. But diabetes alone, if you can figure out your numbers and you know how to manage it, you shouldn't be losing a foot or a limb or anything. Anybody tells me that they've gotten diabetes, yeah. Or find somebody you know who has diabetes or has diabetes who's had complications and gotten over it. I like to help people out at the pool, people that I swim with and have just either become diabetic or have been diabetic and don't know how to control it. I help them out. I tell them this is how I do it. And it becomes helpful to know other people are going through the same thing you're going through. And it's nicer to know that, okay, I messed up in the beginning, I can fix it. It's something that can be fixed. But education is the number one. You got to educate yourself, whether it's to other people who've been through it, or computer, doctor, pharmacist. Find somebody who knows about it and talk to them.
Fire, arson, and perseverance. Find out what this all has to do with diabetes and the microvascular system next episode, as we talk to Richard and Sandra and hear their incredible story of avoiding getting a foot amputated and living well with diabetes.